So what is a geriatric care manager? How can they help? What can they do? And how is it paid for? Common questions we get asked. Hi, I'm Ignacio with North Star Senior Advisors and North Star Cares. And here in Central Florida, we provide geriatric care management services under our North Star Cares brand. So let me go into what is a geriatric care manager. This is an individual that's credentialed. They've been doing this for quite a long time. At least our care managers have been at it for years of experience. But here's the best way I can describe a care manager. Think of a high-level liaison, okay, that gets deployed to assist you with your needs for your loved one. Now, when I say high-level liaison, it's not a caregiver. It's not somebody that's going to be sitting in a home, helping with care needs. That's different. That's a different service. That's private duty home health. A care manager as a high-level liaison will be an extension of that family member, that POA that gets their services. So for example, they can do things like coordinate care with physician, hospice services, home health services. They can coordinate the care, communicate with the staff in those services, and report back to the POA or the family member. They can also do the same in senior living communities. They can communicate with senior living communities and report back their findings. So think of it as like a buffer or somebody that can step in and act on the behalf of the individual. When should you consider a care manager? So what we've seen over the past couple of years, the most common need for a care manager is going to be for individuals that are out of town or out of state. We're here in Central Florida, so we help families that they live in New York, other states, but their loved ones are here locally and they don't have anybody else to assist them. So a care manager is deployed and they're basically boots on the ground, eyes on, assisting with everything, coordination of care. Also, they can help with downsizing of a home. So it's pretty broad and gray what a care manager can do, because it can be a lot. Helping with estate planning, you name it. A care manager can step in and help that family member or POA that may not be local with anything and everything they need, okay? Another reason we see a care manager deployed is if a POA or family member is at a point where they're emotionally taxed, they can no longer deal with the situation for health reasons, family reasons, they have their loved one, they wish they could help, they just don't have the time or the emotional capacity to be involved to that degree. So they'll deploy a care manager to assist with everything around their loved one's needs. So those are usually the most common occurrences when a care manager is needed or deployed. And how is it paid for? It is paid privately out of pocket. Insurance doesn't cover it for us specifically, but it's a great service. And the way that it's set up is there's an initial assessment to determine the individual's needs. That comes at a price, of course, and then it's an hourly rate after that if the services are continued. If you'd like more information about care management, how a care manager can help you, and our pricing, let us know, and we'll be more than glad to share that with you.